Line, why has there a national center for eHealth been created in Norway?
The Norwegian government has launched its national eHealth strategy, and they would start implementing the strategy, and then they would like to have a national actor, which can document the implementation of the policy if they've decided on.
So what all is part of that documentation? Is it registering, monitoring the benefits, the actual benefits and the presumed benefits? Is it about return on invest?
It's actually all of it. So, and they're giving us tasks, and it's just started, so they've given us some tasks. We are, for instance, given a task to cooperate with the new Directorate of eHealth for evaluating the e-prescription system, part of it in Norway, and also other national actions which have been made according to the national plan.
What else in that portfolio besides medication, besides prescription? Telemedicine activities, for example?
Yes, it depends on what the ministry wants us to do. If they would like to implement larger telemedicine services during the phase which we are going into, they could ask us for doing the evaluations of the setups. But they also ask us for knowledge on what's been what is being done in the rest of the world. What is the key learnings and findings, etc., before they start giving us tasks and before they start entering into their own realization of their processes.
So you've been doing scouting all over the world with regard to available solutions?
We are starting on that process right now. We're starting on looking into that kind of documentation for the Ministry and the Directorate of Health, together with the Directorate.
Are you finding the eHealth 2.0 Europe conference beneficial for that?
Yeah, it's interesting to go to such places and meet up with people, and then to listen to the discussions to see if the discussions are similar to the discussions going on in other conferences and arenas in the eHealth world. And actually, I find it quite similar to what's being discussed in other arenas as well. So everyone is actually looking for tools and ways of documenting the implementation of services.
The setup of healthcare sectors varies by country, of course. So in Germany, for example, we have quite a variety of public and private insurers. In Norway, the situation is different. There's only one organization that takes care of reimbursement, right?
Yes.
Would you consider this more helpful or more complicated as a solution with regard to implementing these innovations?
I think that even if we have one insurer, it's a system which is quite, you know who the different actors are, but it's still complex, and it's still, implementation of electronic systems and services actually always faces that the persons who are involved, the actors, doctors, nurses, patients, etc., they need to change behavior. And behavior change is one of the key topics in the future, I think, to understand that. And what would be the incentives? What are the incentives to try to realize the change?
Now, with regard to eHealth solutions from Norway, do we also do anything with those?
No, we don't do that. We are not connected to any of the Norwegian vendors. But some of the vendors, national vendors as well, international vendors, are part of some of our research projects, but that's projects are being funded by the EU Commission or by the Norwegian Research Council, but not for the national part.
Would there be any kind of country that you are looking at as a model, like in the Nordic countries? There's quite a few very active countries.
We will be looking into that right now in for the new activities we're doing for the government.